Angela Clendenin is an epidemiologist at Texas A&M School of Public Health, and she joins us now live from College Station in Texas. Thank you so much for joining us on the program today. Now, 3 million doses are to be shipped of this vaccine across the U.S., and people are going to start getting vaccinated as soon as Monday. How exactly has the CDC laid out its plan as to who gets vaccinated first and who can't get vaccinated just yet?
So they really looked at a priority schedule, and they're prioritizing our frontline healthcare workers. We consider them our first responders in the hospitals. They are dealing with our COVID patients on a daily basis. So they are an extremely high risk group. So it makes sense that they will be in that front line to receive those vaccines. Immediately following that, we're prioritizing long-term care facilities because the people who are in that elderly category are also at high risk for severe disease with COVID-19. And then beyond that, it will go down to things like teachers, and we hope to be able to have it widely available by April or May, that we'll be seeing more widespread distribution of the vaccine.
Right now, this Pfizer-BioNTech vaccine is the one that will be used for the most part across the U.S. And it's been a week or so now where thousands of people in the U.K. started to receive that vaccine. What are some of the side effects people who've been vaccinated have experienced, and has this changed the ideal profile of who could and can't get vaccinated?
So what we're seeing from some of the earliest reports in terms of side effects is some mild fever. You don't feel very good, but they are very mild symptoms compared to what one might experience with actual COVID-19. So it really hasn't changed how we prioritize who can get it. We really are trying to prioritize based on risk and risk of severe disease.
And what would you tell people who are indecisive on taking the vaccine and are worried about the long-term effects that it may have?
So, what I would tell people that are a little hesitant about uptaking the COVID-19 vaccine is that the clinical trials that Pfizer has put this vaccine through, and the subsequent Moderna vaccine that will be coming out shortly after, is very rigorous. The FDA, yes, they took a little bit less of a time to get to the emergency use authorization approvals, but they still had a very rigorous standard that these vaccines had to be held to in terms of efficacy as well as safety. And I intend to fully be first in line when my point and priority comes up. I have no concerns about the safety. I have no concerns about the side effects.
How soon can we expect to see a downward trend in the infection rate?
That is largely going to depend on how many people are willing to take the vaccine. The more people that are willing to take the vaccine, then that means fewer people the disease can transmit to. And so it will be sort of this inverse relationship. The more people that take the vaccine, the deeper the downward trend. But it will be at least 14 days from those initial vaccinations, from initial widespread mass vaccination, I think, before we'll ever see a dent in the COVID case numbers.
All right, Angela Clendenin, epidemiologist for us there at Texas A&M School of Public Health. Thank you so much for joining us on the program.